Greetings, my fellow IDD subscribers. In the last talk, I explained the two tests used for non-specific lower back pain: provocative discography and dual diagnostic blocks. Provocative discography proved that internal disc disruption is the most common cause of pain, essentially unknown. And this is the paradigm that we hope to change, and maybe with your help, we can explain this painful condition and get it more established. So, what other findings did the medical researchers get using provocative discography and dual diagnostic blocks? The information to me is invaluable. So there's a link with age. If you're young, 43, with lower back pain, you have above a 70% chance that the pain is from internal disc disruption. On the other hand, if you're 55, you only have a 20% chance that it's internal disc disruption. So in the older patient, the likelihood of lower back pain is from the sacroiliac joints or the facet joints. The facet joints are where the joints meet at the back, sort of in that area there, or look at this area. Further findings were that the discs most likely to cause pain are L4 and L5 discs. So they're the most likely to cause internal disc disruption. Further information was the anatomy, the anatomical area of pain. So if you were tender on the midline, down the midline of the lower back, it was probably internal disc disruption. If it was 1 finger breadth to the side, it was probably facet or SI joint. So if you were tender on the outside, pain would either be the SI joint or the facet joint, but if you were tender in the midline, it would indicate that the pain is probably coming from one of the lower discs, as we now know, internal disc disruption. So the next talk will be on the little bit about the anatomy of the disc and the pain mechanism involved with internal disc disruption. Thank you for listening.